Hello, everyone. Hope you're enjoying your lunch. In the interest of time, we are going to get started, but please feel free to continue enjoying your lunch, and we'll get on with the program. We're delighted today to recognize some up-and-coming difference makers. Established in 1956, the Robert Wood Johnson Awards are presented to one student from six Canadian universities offering a Master's of Health Administration. Recipients are selected by their respective faculty for their individual achievements and promising contributions to health services management. On behalf of the college and our members, I'd like to applaud Johnson & Johnson MedTech for their continued support of this award. Thank you. I believe that it's vital that we recognize excellence and to support the support of our emerging leaders. Without further ado, I'd like to invite Anuj Pasrija, Vice President, Strategic Customer Group Canada with Johnson & Johnson MedTech, to take the stage to introduce the 2024 Robert Wood Johnson recipients. These individuals are joining an exclusive group of health leaders. We look forward to following their careers. Thank you.
Thank you. Thank you, Brenda. Good afternoon, everyone. Thank you for joining us for this special occasion. And as Brenda mentioned, we've been sponsoring this award and the lunch event for, I think, 69 years. It's been a long while, way longer than my age, so I cannot say I've been presenting this award. And it's really great to see these six wonderful young leaders who are outstanding as a talent within the Canada's Master of Health Administrative Programs. So it's a pleasure, and congratulations to all the winners. These students are chosen by their faculties and their institutes based upon their skills, knowledge, attitude, which is really necessary to practice healthcare in Canada. And they are the future leaders for our Canadian healthcare system. And Johnson & Johnson is really proud to support their accomplishments. As you know, that I think this year's theme is Come Together. You don't have to say right now. You can continue with your lunch. We're very pleased to again come together this year. If you remember last year, we had a theme Reunited. So as I look back, I think it absolutely resonates. We were reunited last year after a lockdown of almost 3.5 years, and now is the time to come together to really work on the call to action that we would have made last year. So I really look back. I don't want to use the word pandemic. I think it's something we've overbeaten the word, but irrespective, I think what we experienced in those 4 years has taught us a lot of lessons, a lot of good learning. I think our system was certainly put to a test with that crisis, and we learned a lot of lessons and stories of hope and despair, and it moved us a lot. Collectively, I think all the healthcare system leaders, nurses especially, and all the healthcare providers, they worked tirelessly. I mean, the system had a real rough and a hard time looking after all our patients and really managing a lot of demand on the system that wasn't really geared up with enough resources to manage that sort of burden. We've also come together to respond at that time and even now for those post-pandemic challenges. And we have really seen how our health systems are really transforming, whether it's shifting the care outside the hospitals or it's actually expanding the scope of the pharmacies to provide at least some level of care. So a whole lot of things have evolved post-pandemic, including virtual care, which kind of got accelerated during pandemic, sort of got stalled, but a lot of systems have now permanently evolved into virtual healthcare system. So I think a lot of innovation that happened because of the crisis, I think it's something here to stay and only grow with time. We also saw a lot of other weaknesses in our healthcare system, long wait times, especially on the orthopedic and multiple other surgeries. People couldn't get to see their doctors. They still have long wait times to go. And despite the best attempt, the system will still need considerable time before the care is really provided. And they're doing their best. Of course, we are fully confident. But imagine a patient's plight and the family's plight when you have to wait so long for your procedure. Every single day, every single hour really counts for them. And with our aging population and growing chronic diseases, with limited and finite resources in the healthcare system, I think these things really require more action to come together and make a difference for our healthcare system. And as we come together for this conference, each one of us have had the opportunity to learn and really find ways, in our own ways, whether you're in the hospital or you're in the industry like me, or you are in the supply chains, irrespective, all of us have been collectively trying to make our system, as I call it, crisis or pandemic proof. I don't think anybody can ever guarantee that there couldn't be another crisis or pandemic, but what we can certainly guarantee is we've evolved a lot, and I think we'll be way more resilient, and we're geared up to now addressing these issues and challenges way better than in the past. Coming together also really for us means working collectively, not as silos. I think it's not one entity or the other. Public sector alone, private or industry alone, or nonprofits, all of us will have to work collectively. It cannot be just one system coming together and trying to fix all the problems. It really needs a collective action, and we need to break our silos down. And as an industry, as a part of J&J, I can tell you, our large leading organizations, especially as my colleague here, Raj, would say on behalf of the industry members, I think all of industry, it's obviously been working beyond just as profit. I think a lot of our companies stood up and really supported the system, and they had to really innovate overnight and really work through their supply chain systems to make sure every Canadian had access to health when it needed. And in our own way, we have been supporting the healthcare system here. So fostering that culture of collaboration and partnership amongst all the stakeholders and leveraging our own individual, unique expertise and strengths, but putting them all together, it's again to the theme, come together. That's what I keep saying, come together, because every single sector will have its own unique role to play here. And it also means we need to embrace now innovations and transformations. We can't just be doing exactly what we were doing for so many years. Unless you do things differently, you don't expect different and better results. And it's not just technology, it's not about just data. When I say innovation, it means across. It means the way we think, the way we act, the way our processes are, the way the patient flow is, and the way the goods and supply chains work. Everything will have to transform in a very innovative way, because our resources are going to be still as much as what we have, but the demand is already outstripping the supply side of the healthcare equation. So which means we need to have more technology and more automation and more innovation to really help the system sustain. And we definitely need to invest on those innovations, which are actually providing measurable, better health and economic outcomes, because everything otherwise is sometimes termed as innovation and everything is termed as partnership. What is more meaningful is something that is actually delivering measurable, tangible result, making the patient's life better, reducing the cost for the system, and enabling access. I think to me, those are the measures of innovation that has to be backed by enough data. Coming together also, how we care for ourselves and each other. It's not just about coming together for making the system work, it's also we saw the burnout for the human health resource. A lot of people left us during that pandemic, haven't really even come back. So unless we are caring about each other, unless we are concerned about how these people get burnt out delivering health systems and all the delivery of healthcare system, I think that alone is not going to work. We really need to have the human element of caring about each other so that the system is really fully sustainable. So I personally, if you ask me, I'm very optimistic by nature, and even otherwise what I've seen in last, I would say, 2.5 years of all the system changes that are taking place, including the political will. Every single day in the newspaper, we would read about, all the commitments that are being made in the system. They're trying to bring a uniform license. They're trying to bring in more nurses, trying to change the care where it's delivered, empowering more GPs. There are, of course, a lot of challenges, but overall, there's an optimism. There's a positive move, and I think it is coming towards the right. And now with these health leaders that are being chosen here today, that's the young, bright minds that we have in the health system. So I'm very happy and very optimistic. It's these kind of people who are really going to take our system to the next level. And they have really already demonstrated their excellence, passion, potential, both in their academic, but also in their professional pursuits. And they are the ones who are actually going to create the better health system for us. So thank you for what you're doing, and that's why you deserve this award. And I have no doubt that you'll really be inspiring others with your journey from what you've done, and that's why you're here today for these awards. With that, I would love to invite here CJ Blennerhassett as the first winner. Please put together your hands for CJ. CJ is a registered midwife with 8 years of clinical practice, providing primary care to hundreds of families, specializing in the prenatal, intrapartum, postpartum, newborn, and sexual and reproductive health. And CJ will be she graduated in spring 2024 with Master of Health Administration from Dalhousie University here in Halifax. And CJ is president of Canadian Association of Midwives, with a role has represented Canadian healthcare system on international stage. Is an experienced teacher, clinical preceptor, and extensive speaking experience across interprofessional audiences, appearing at conferences and conducting workshops about the provision of inclusive care for queer, transgender, and non-binary patients. CJ strongly believes that the midwifery philosophy of informed choice is foundational to the provision of inclusive healthcare, and patients should be the center as experts in their own care. So please do join me in congratulating CJ.
Thank you so much. I appreciate this. I've certainly spoken to crowds before, but I don't know that I have ever spoken to this larger crowd with a 15-foot picture of my face behind me. That's a new experience for me. I would like to express my deepest gratitude for this honor. Thank you to the organizers of the CCHL, of this conference, Johnson & Johnson MedTech, to Dalhousie University's faculty and staff for bestowing this honor on me. Thank you to staff and management at the IWK, where I work, who are responsible for allowing me to take the time to do this degree, and to my mentors who have supported me tirelessly on this journey. As you've heard, I'm a registered midwife here in Nova Scotia with expertise in sexual and reproductive health, which stems from a profound belief in the transformative power of accessible, compassionate healthcare focused on informed choice. Unfortunately, perinatal health receives little attention amongst the many competing and very important priorities of our health system. But I would be remiss if I did not take this opportunity to underline the fact that it is an area of healthcare that unites us all. We do not all give birth, but we are all born. And we begin this journey with that essential healthcare encounter. The level of investment we devote to caring for people through pregnancy and birth, in my opinion, speaks directly to the health of our society. This award is not just a recognition of academic achievements, but a testament to the importance of leadership. In these roles and within these spaces, we have power. And when we have power, we also have an obligation to advocate for policies that center the stories of those whose voices are often unheard. Leadership is a pledge to amplify these voices in our work. In a world where disparities persist, where individuals face barriers to essential services, where war and conflict target healthcare workers in an effort to impact their ability to care for communities, our commitment to equity must drive us forward. To my fellow students of all ages, I share this accolade with you. Each of you has contributed to my growth and learning, and those of us receiving this award today on this stage are here because of your collective brilliance and support. Thank you.
Thanks, CJ, for sharing your thoughts. The next winner is Sukhpreet Gill. Sukhpreet Gill is from University of British Columbia. Sukhpreet entered the health system passionate about health promotion and disease prevention. She received her Bachelor of Science in Nursing from Kwantlen Polytechnic. I hope I pronounced it correctly. Sorry if I mispronounced it. Following graduation, she started her career in public health, where she engaged in numerous community events to spread knowledge about her healthy behaviors. Through her work in various positions during COVID-19 pandemic, Sukhpreet was introduced to the complexities inherent in the healthcare delivery. The experience motivated Sukhpreet to enroll into Master of Health Administration at the University of British Columbia. And following the pandemic, Sukhpreet pivoted to a role in the community and primary care sector, where she's been able to apply the learnings from her MHA program to her work in improving access and delivering primary and urgent care services. Set to graduate in spring 2024, Sukhpreet looks forward to leveraging the tools and skills honed through her MHA program to make a meaningful impact on the patient care and healthcare system. Please join me in congratulating Sukhpreet. Welcome to the stage.
Good afternoon, everyone. It is an honor to be here today. I would like to thank CCHL for organizing this incredible event, Johnson & Johnson for sponsoring this award, and the UBC faculty for my nomination. Early in my MHA program, while participating in a leadership course, I jotted down a quote by Stephen Covey that read, "Change moves at the speed of trust." This resonated deeply with me and became a guiding principle in both my academic pursuits and professional work. I realized its profound relevance in my roles as a student, nurse, and a leader within the healthcare space, emphasizing the pivotal role of trust as a catalyst for growth and learning. Within the MHA program, trust was instrumental in fostering a safe learning environment among both my peers and the faculty, where I felt empowered to ask questions, freely exchange ideas. The trust within our cohort not only facilitated my learning from my fellow peers, but also allowed me to gain invaluable insights into the complexities of our healthcare system. As a nurse, I recognize that trust is not only confined to the nurse-provider relationship, the patient-provider relationship. It binds the entire healthcare community together, which drives innovation, collaboration, and ultimately transformation. This quote highlights the role of trusting relationships in creating meaningful and sustainable change within the healthcare system. It reminds me of the effort required to cultivate and nurture these relationships, for they are the cornerstone of progress in healthcare. Together, I invite everyone to reflect on the transformative power of trust to shape the healthcare system that is not only efficient, but safe and equitable for all. Thank you. Thank you.
Thanks, Sukhpreet, and congrats again. And please join me in welcoming the next winner, Jade, Jost from Montreal. From University of Montreal, she graduated from the university with a bachelor's degree in nursing in 2018. Since graduating, she has worked as a registered nurse in the emergency department of McGill University Health Center. Her commitment extends beyond patient care. For 4 years, Jade actively participated in the organizations and demonstrated exceptional leadership. She served as a committee's president for the 2 years, advocating for nurses with less than 5 years of experience. Her initiatives focused on providing crucial support and representation for young nurses, creating a nurturing environment of community and professional engagement. Her motivation of enhancing hospital fluidity and access to care led her to embark on a master's degree in health administration at the University of Montreal. Throughout her academic endeavors, she cultivated a keen interest in innovation and technology, recognizing their potential within the healthcare sector. And driven by an unwavering dedication to fostering positive change in the healthcare, Jade envisions contributing to the ongoing transformations of our healthcare system. So please join me in congratulating Jade. Come on in here, Jade.
Good afternoon. It's with deep honor and gratitude that I accept this award today. I want to extend my heartfelt thanks to the CCHL, Johnson & Johnson, and Université de Montréal for this recognition. I was never a straight-A student. Matter of fact, I was quite average. And it wasn't until I started working in the front line as an emergency department nurse that I truly found my voice and my purpose. It was through my involvement in hospital committees and different initiatives that I aimed at improving patient care and advocating for young nurses that I began to embrace my role as a leader. I'm grateful to those who have recognized my potential and stood by me on this journey. To my colleagues, supporters, and loved ones, thank you for believing in me and inspiring me in this journey. While I'm just beginning in my healthcare leadership journey, this award serves as a powerful validation of my potential and motivates me to contribute growing. Thank you once again.
Thank you, Jade, and congratulations again. Our next honoree is Emma Forrest from University of Alberta. Halfway through her Bachelor of Science in Biology, Emma discovered a keen interest and passion for the areas of substance use and mental health. While preparing for a research-focused career, she engaged in several diverse projects throughout her first degree. Additionally, she volunteered work through Alberta Health Services, which provided the opportunity to interact with and to learn from members of vulnerable population and to create health promotion materials relevant to substance use and mental health. This dual motivation, blending in professional drive with a heartfelt desire to aid those who need, shaped her journey. Introduced to the public health in final semester of her undergraduate degree, Emma's path became clear. The Master of Public Health program equipped Emma with skills in program and policy evaluation, strategic planning, system thinking, and person-centered design, which she eagerly anticipates applying in her future career. She completed a practicum placement with Alberta Ministry of Mental Health and Addictions, where she supported planning for various community-based mental health and addiction programs and initiatives for children, youth, and young adults. Upon graduation, she aims to explore the world, continuously learn and contribute to positive change, step by step. So please join me in congratulating Emma.
First off, thanks, Anush, for that. What a surreal moment. Firstly, I'd like to express my gratitude to the School of Public Health at the U of A for, first off, choosing me to be in the program and choosing me to be one of the recipients of this award. It really is an honor. I wouldn't be standing here today without the support of my friends, family, and mentors. Special shout out to my mom, who's here with me today. Thank you for believing in me, cheering me on, and providing endless encouragement every step of the way. To all of my fellow recipients, congratulations. It's really inspiring to be recognized among such a remarkable group. Let us continue to support and uplift one another as we embark on our future endeavors in health services. To be a part of this tradition is really humbling, and I'm grateful to Johnson & Johnson MedTech and the CCHL for making this recognition possible each year. As I accept this award, I'm reminded of the responsibility we all bear to contribute positively to the field of health administration and to make meaningful impacts on the lives of others. Let us continue to strive for excellence, innovate boldly, and advocate tirelessly for accessible, equitable, high-quality health services for all. Thank you again.
Thanks, Emma, and congratulations. Our next award recipient is Cassandra, 14, from University of Ottawa. Cassandra completed her BSc in Honors in Biomed Science in 2013 and her BSN in 2015. She worked as a registered nurse at the Ottawa Hospital, primarily in the emergency department for 7 years, driven by the need to invoke continuous quality improvement within our healthcare system. She went on to complete her Master of Health Administration at the University of Ottawa. She's also recently obtained her CHE designation. And during her residency at Cornwall Community Hospital, she worked with the Great River Ontario Health Team to address the health human resource challenges of the region. Today, Cassandra works at Kemptville District Hospital as the manager of emergency care quality and education. Included in her role, she facilitates education for staff, works on quality improvements, and is leading the accreditations and manages IPAC, Infection Prevention and Control, and clinical scholars in patient relations. Cassandra has a passion for quality improvement, patient and family-centered care, and ongoing learning. So please join me in congratulating Cassandra.
So good afternoon. As noted, my name is Cassandra. I'm a manager of emergency care quality and education and a registered nurse by trade. I cannot begin to express how grateful I am to be one of this year's recipients of the Robert Wood Johnson Award. It's a true honor to be here amongst exceptional colleagues and leaders in healthcare. I would like to thank the CCHL for putting this event together and Johnson & Johnson for continually sponsoring this award and thereby recognizing its upcoming healthcare leaders. I would also like to thank the University of Ottawa, Telfer School of Management for the nomination, as well as their mentorship and guidance throughout my MHA program and beyond. I'm very fortunate in my life to have a very good support system, without which I would not be here today. So with this in mind, I would like to thank my colleagues at KDH, my MHA cohort, my friends and family. A special thank you to my husband and parents who have always been a pillar of strength and encouragement throughout my life. As I go forward, I hope to honor the spirit of this ward and those who have helped me in getting here by continuing to strive towards excellence in healthcare leadership. Thank you.
And with that, the sixth and the last award winner for us today, Danielle Annamalai from University of Toronto. Danielle received her Doctor of Chiropractic degree from Canadian Memorial Chiropractic College in 2009, completing a residency program in 2011. She holds a fellowship from the College of Chiropractic Sciences Canada, where she currently serves on the board of directors. She has over 10 years of clinical experience, having worked in interdisciplinary care teams in urban settings, both across US and Canada. She's dedicated the last 10 years of her career in advancing care for people with musculoskeletal disorders through research, knowledge translation in her role as a research project manager at the Institute for Disability and Rehabilitation Research. In 2022, she enrolled in the MHSC program, which is the Health Administration program at the Institute of Health Policy, Management and Evaluation at University of Toronto, where she's had the opportunity to further develop her capacity as a healthcare system leader. In 2024, Danielle began her career with Ontario Ministry of Health in forming policy that will shape system transformation and advance integrated care across the province. Danielle is passionate about solving the complex problems facing healthcare system today and aims to continue her commitment to leading system-level change, improving the health and well-being of all people. So please do join me in congratulating Danielle.
Good afternoon, esteemed colleagues and health leaders. I'm humbled by the opportunity today to listen to the discussions that have been going on throughout the room as we celebrate the community that has been cultivated by the Canadian College of Health Leaders. I'd like to extend my heartfelt congratulations to my fellow award recipients, and I'd like to thank all of those who brought me here to this podium. The CCHL and Johnson & Johnson MedTech as award sponsors, my community at IHPME, the faculty, administration, and my fellow graduating classmates, who have provided me with the foundation and the inspiration to begin my healthcare leadership journey. And finally, to my family, my husband in particular, who's here with me today, for unwavering support and for believing in me even when I didn't believe in myself. To echo what has already been articulated many times today, the challenges facing healthcare are increasingly complex, and now more than ever require collective thinking and enhanced collaboration system-wide. As someone who is just starting on their healthcare leadership journey, it's comforting to know that I'm surrounded by so many people in this room who are willing to do that hard work, willing to share their successes and their lessons learned, and willing to be part of the collective innovation that is so desperately needed to create the meaningful change we need. Thank you again for coming together and for giving me the opportunity to listen to your stories. Thank you.
So congratulations again to all the awardees on behalf of J&J, and we'd like to thank you for your focus, your contributions, and your dedication to the healthcare system. And with you, I'm sure we have a greater, better future for the Canadian healthcare system, so thank you. I'd like to invite now Brenda and Elaine and 6 other award recipients to please come and join us on the stage for a group photograph.